networking session, but for those of you who have joined since, John Fryer, Senior Vice President and Head of Market at Lumeris. We're a value-based care operator working with health systems and payers really across the United States. Background in health tech, so I actually started my career at Cerner, the large EMR vendor, before moving into strategy consulting. So I like to say I'm a recovering strategy consultant and now leading up market activities for Lumeris, which is a Kleiner Perkins backed company. We've been around for about 10 years now. So excited to be with you all this morning. But really, I'm very fortunate and excited to have the opportunity to moderate this esteemed panel, and think everyone is going to really enjoy hearing from these industry leaders and getting a little bit more information on their perspective and even how they define this Internet of Medical Things industry, because obviously it's a very broad topic. But before we dive in, I wanted to kind of highlight the key objectives that I have for this session. There's really three things that I hope all of you as attendees get today. It's really an understanding of the evolution of the industry, as well as the acceleration that's occurred since the pandemic really took hold last spring. We've seen a rapid acceleration and adoption of these Internet of Medical Things technologies, platforms, applications, and investments, as well as think through what is the value proposition of this growing digital industry in healthcare, and how do we understand the stakeholders and the business models that will have to come into place to support the continued growth of the industry. And then lastly, I think we'll bring home with hearing from our panelists about what they see as the lessons learned and what entrepreneurs and investors should be thinking about as we look across this industry. So I'll stop talking now and would love to turn it over to each of our panelists to provide a little bit more of an introduction of themselves and their backgrounds, as well as to answer the question of, how would you define the Internet of Medical Things as an industry? So without further ado, we'll turn it over to Fabien for your introduction. Fabien, you might be on mute.
You're muted.
Hi, thanks, John. So yeah, for those who were there on the previous panel, I founded a company called Arterys. We really try to enable a new era of healthcare to be data-driven for the diagnostic side of things with AI and predictive, and feeling that there's so much data out there in the world that is not leveraged every day to really impact patient care. So we try to find a new structure, leverage the power of the internet to really transform that around the world. Raised 75 million doing so out of Stanford for the last 9 years. And so in that regard, I think IoMT really feels very much square in that new vision of the fact that now this is a new dimension where before most of the care was provided within the walls of the hospital. And now you really have this extension that's going to come in very different ways and more continuously to an amalgamation of software, app, and devices that wirelessly connect to the heart of the hospital, still a long way to go to achieve that, to really make sure that we can really take care of the patient outside those four walls and much more in advance of where the sick events and the critical events happening. That's one example of it.
Great, thanks, Fabien. Lindsey?
Hi, so a little bit about my background. Started off in biotech, leading early commercialization for new products in the urology and genomic space, specifically with prostate cancer. Before moving into more leadership roles, I served as general manager for a portfolio of companies in the medical device space. And the last 4 years have been consulting with very early stage startup companies commercializing new products. So to me, the Internet of Medical Things is really the new frontier of medicine. And much like the way Amazon shifted how consumers, experience retail, I think the Internet of Medical Things is going to shift not only how we access, but how we consume healthcare. So I think it's really interesting looking at all the new stakeholders and how the shifts of power between stakeholders have happened with the Internet of Medical Things.
Yeah, I think that's a really exciting point and something I think we'll dive into a little bit deeper here in this panel. Alfredo?
Yeah, thanks for teeing us up, John, and thanks for everyone's background and thoughts. I think I have similar feelings as we think about the Internet of Medical Things. So just quickly, my background, strategy consultant. So John and I actually used to be former colleagues we talk shop a lot. We have healthy debate. We promise we won't get a debate in front of everybody today. But anyway, hopefully we can keep that promise. So strategy consultant, I was previously in private equity, investing in healthcare services. Today, most of my clients are healthcare systems, kind of helping them with just general strategy, whether it's kind of growth strategy, acquisition strategy, as well as digital health strategy, as that's becoming kind of a bigger and bigger role. We also do work with private equity firms and tech-enabled kind of companies. When I think about the Internet of Medical Things, I mean, it really comes down to the infrastructure around digital health. I'm not a big fan, actually, of the term Internet of Medical Things because it kind of, there's an assumption that it has to be clinical. But as we think about health actualization, there's a lot more to kind of to digital health than just the clinical side. So look forward to the conversation.
Thanks, Alfredo. And last but not least, Balint.
Hello, everybody. My name is Balint Bene. I'm the CEO of Bene Studio, and Bene Studio is a digital product consultancy. We have a special focus on health tech, and we delivered more than 100 premium quality mobile and web applications so far. And we integrated different systems for enterprises and for startups as well. With this background, I can see the IoMT industry as a technical solution, which makes the healthcare more patient-centric and which increases the user experience, which is one of the most important aspects, I believe. And also it generating more accurate and frequent data, which ensures more automated and effective prevention, care, and aftercare. So this is how I can see IoMT, but I think we are just in the beginning of this journey.
Great. Well, thanks to all of our panelists for joining us this morning. One item of housekeeping. So hoping to keep this panel very discussion-based today. So as you all as attendees have questions or topics come up that interest you, please do plug them into the chat and I'll try and moderate that and work them into the discussion. But I kind of wanted to start us off really at the highest level and understanding, with the pandemic and the trends that existed pre-pandemic, what is the healthcare industry as a whole going to look like in the next 5 years? And I think there's some kind of interesting statistics I wanted to reference related directly to the impact on the pandemic. But I think it's really important when we think about IoMT and the business model and how it's going to fit into the ecosystem. But just, some statistics to date, the AHA as a whole has projected that hospitals are going to lose $323 billion in 2020 alone. So that doesn't take into account any of the pandemic's impact moving really from this point forward, $320 billion of losses in our healthcare delivery systems, 6 million less people in the workforce. So the payer mix of our health systems and our care providers is going to change and is going to create growth in the Medicaid population. And greater than 10% unemployment projected all the way through 2021. On top of that, you couple the fact that by 2025, statistics show that 1 out of every 2 individuals in the United States will have some type of chronic health condition, which accounts for 7 of every 10 deaths in the United States today. So with all those lovely facts that I'm sharing about the kind of state of our industry, I think it really serves as a challenge to everybody on this call today to what can we do and leverage the Internet of Medical Things to assist our industry as we think about, the future and the future growth. So with that, would love to get Lindsey, your perspective on kind of the evolution of the healthcare industry and where you see it heading over the next 5 years.
Yeah, I think all of those things are going to play massive roles in kind of the shift of, again, how we consume healthcare, how we deliver healthcare, specifically speaking to digital health and telehealth. And particularly, I think it's really interesting that it's shifting the accessibility, right, for patients. And there's a minimal focus, but some focus on different types of companies that are trying to, get access to under accessed populations, right? The Medicaid population. Healthtech for Medicaid is like a initiative that's doing that. But also when you start to think about basically the way that people are going to engage the healthcare system. And I think we spoke of this the other day when I said, I really look at it as almost two large buckets. If you're going to have patients who are going to engage on an acute basis and then on a chronic basis. And obviously what we're seeing right now is a lot of acute in terms of the way digital health has been engaged, but that's going to shift dramatically more to chronic as those statistics that you just referenced continue to increase over time.
Yeah, I think that's a great point, Lindsey. How do you see that though, that, that chronic versus acute, not creating kind of disparate pieces and information sitting in silos with, niche chronic care providers versus a primary care physician versus the hospital that one of these patients may ultimately end up in?
Yeah, and I think that's an imperative for us as an industry, right? To come together and work together to create cohesive systems that can talk to each other. As I was sharing just the other day, that a community of chronic patients in the bladder infection world have already discussed online how they're leveraging access through these, kind of doc in a box scenarios digitally to a doctor shop for prescriptions, right, to treat their issues. And that they're like, oh, well, I just went to this doctor and then I went on that line and then this when, I can prescription services. And I basically, tallied up 6 weeks worth of antibiotics because I've got this terrible chronic infection that I think that will cure. Which most physicians would never write for 6 weeks. So I think it's going to be really interesting to see how we can try to be very mindful of identifying these gaps in care and understanding what frictionless care models can be developed and how we can work together to create a system that doesn't exacerbate the gaps that already exist.
Yeah, I think that's a great point. When you think about, the next 5 years, obviously we're in a period of kind of rapid growth in the space. Lots of companies coming into the digital health space, lots of companies coming into the connected health space in particular. In the next 5 years, do you see that growth kind of continuing to propagate, or are we going to see some consolidation and some potential M&A activity, as all these solutions kind of try and find their home?
I think we're going to see significant M&A activity, and I think it's going to come from players in the tech world. I've already been getting calls from people from Verizon and Comcast and these, venture arms of these large tech companies, and Verizon's having conversations about how do we own, telehealth as a platform? How do we, create these systems? So I think it's going to be very interesting to see the kind of the medical and the tech worlds collide, especially in the area of connectivity. I know we're going to talk more about 5G in a little bit, but I mean, this is just one area where we're really seeing convergence of ideas. And so I think a lot of these companies that are, popping up with these $5 to $10 million seed rounds for telehealth platforms are going to start to get consolidated over the next 5 years. I think we'll see a lot more growth first, and then towards the end of that 5 years, we'll start to see significant consolidation.
Yeah, I think it's a really exciting period, and I like the fact that you bring up these what I like to call non-traditional healthcare players. Pretty much all of the Fortune 500 companies are playing in the healthcare space in some manner. And you brought up 5G, and I think part of what I'm struggling with, and this is where Fabien would love for you to kind of jump in here, is in the Internet of Medical Things, we're going to be creating sheer vast amounts of data that hasn't existed in the past. And we're going to have devices that are spitting second by second inputs back to other systems. So how do you think about it, Fabien, from a standpoint of how are we going to cull through all of these data points that are being created and actually create kind of meaningful insights that can drive a behavior change or drive an action? How do you think about that, Fabien?
I think you have a very good point, John, because I think at the moment it's mostly about kind of like alerts and real-time tracking in some ways. That's what it is. But I think there's a whole new opportunity now of kind of managing that data overload in some ways and make sure that you can use it to really be actionable and really relevant for the patient. So of course, AI and cloud will play a big part in doing those things and find really ways to be trained. And I think there's a really opportunity for everyone that's been in kind of the healthcare has to be the take space. And you really have to understand how to really learn those two well, because one without the other won't work. And the part at the middle of it, of course, is the hardest one, which is integration. And I'm sure, John, you know that very well with Lumeris. And so how do you integrate those data and those systems together as there are no standards today? You don't have FHIRs for wearables and IoMTs. So I think there's a lot of question. And beyond that, you have another one, of course, is the quality of the what we call the ground truth data in AI in order to really know what are you training against. And the other part that's really related to data is data privacy and data security. And one of the big hurdles that people are extremely cautious today on really is sometimes when blocking that evolution, although there's an intent, is really this notion of data security and privacy that haven't been solved yet, I think.
Yeah, I think that's a really good point you bring up. And as I think, across a 5-year window, I think we're at the point where we're creating a lot of the information. And as 5G continues to be rolled out, we're only going to create and see more information. And, as we hit to the tail end of the 5-year window, at least in my mind, we're going to see a lot of platforms and applications develop that really are focused harnessing the information and then feeding it into either a patient's daily life or a provider's care workflows, or another individual in that kind of the ecosystem as we think about the evolution. And Alfredo, this is where I kind of want to jump to you. And I think I can only say this because I have been in the space with you working from a strategy lens, but our health system partners in this equation are not notorious for actually moving quickly and not notorious for being innovative and not known for being first movers when it comes to anything. And I think we've already seen that in the digital adoption. Obviously, everyone on this call can appreciate that the healthcare industry is a major laggard when it comes to digital adoption, but we have seen the pandemic rapidly accelerate a realization that digital cannot just be a silo within your organization. It really has to propagate all the parts of your health system. So Alfredo, in your conversations, in the market with these health systems, how are they viewing it? How are they segmenting the Internet of Medical Things kind of industry? And then how are they actually starting to try and innovate and change, the status quo?
Yeah, I think there's a lot of good points there. A lot of the stats that you kind of started this with, there's nothing like urgency to kind of create innovation and kind of push things. We see COVID-19, it has just tremendously accelerated the adoption, both on the patient side and on the provider side. People were kind of saying that was going to take, 5 years, right? Or things had been developing and kind of weren't getting there. So I think a lot of the kind of urgency and staring at this cliff, whether it's kind of fiscal cliff, kind of payer dynamics, or just the market pushing towards consumerism, that's really getting health systems to kind of start to act. I know we've been seeing a lot more kind of work and thinking about digital health and data as a strategic asset. And digital health is not necessarily just kind of a cost containment type piece. So it's really starting to be seen through the lens of CEOs in the C-suite, really, rather than kind of the chief information officers or technology officers. And the way I kind of usually tee this up is really thinking about, and when you think about digital health, you could think about things like the front end, back end, but I really like to tee it up in terms of where it's delivered. And there's different ways to think about that, because where it's delivered also drives the kind of business model to it, understanding who the users are and who the buyers are. So the kind of traditional place is obviously healthcare facilities. And there's a lot of solutions out there, and obviously there's EMRs and the like, and health systems are pretty well versed in that. But what they're looking at in kind of more detail now is really digital health in the community, thinking about social determinants of health, digital health online, really marketing, reaching out to patients, engaging patients, patient portals, and the like, kind of like the digital front door to the system. Digital health at the home. So that really starts to kind of incorporate, both like kind of health actualization type wellness stuff like Fitbits or medical devices that are being monitored. And then essentially the patient, right? So that would be implanted medical devices. Maybe there's, ingestible pills that are going to be kind of tracked from a digital perspective. So really thinking, kind of outside of just the four walls of the hospital, as Fabien put it, but really thinking about these different elements. And when you think about it that way, then you really understand who the users are and who the buyers are, because your buyer is very different at the healthcare facilities than kind of your buyer at an individual's home, where the home is probably the payer, the facilities would be the hospital or health system.
Yeah, I think that's a really good point. And I think, when we move kind of into the next section of the dialogue, I really want to spend some time on what you just highlighted, who is the buyer. But I think you hit on something interesting when you brought up kind of what you call health actualization and the Fitbits of the world, which I would call was the first kind of mass adopted Internet of Medical Things consumer device. But one thing that, you know, statistics have shown is that those devices were really adopted by healthy individuals. They were by people who are out running every day, people who are out biking every day, not the individuals who actually are these polychronic condition patients that are ending up in our health systems and ending up in our physician groups. So how do you think about the adoption cycle and how we actually take some of these Internet of Medical Things devices, applications, and platforms and get them adopted in a population that to this point really just hasn't cared about their health?
Yeah. I mean that's a great point. I mean, overall, I mean, adoption is difficult. I think at the end of the day, you know, how do you start to get there's a lot of noise out there, right? So as we think about the Fitbits, first you kind of have to kind of get through the noise and make sure that, you know, you don't necessarily want to kind of adopt Fitbit potentially into kind of your clinical care plan. I think that the real way to get people to adopt it is to make sure that the incentives are there for those individuals to adopt it. So, you know, there's a lot of incentive for a payer or a health system that wants to keep a patient out of the hospital, for example, but there's not that much incentive for the individual other than kind of tracking, you know, just being healthy and having a nice lifestyle. There's not that kind of direct incentive that payers and providers have with patients. And I think there's evolving models and kind of evolution on that piece to ensure that the value capture and all the solutions is kind of being well represented with the users.
John, I'll just jump in and say on that too quickly that, you know, I think it's interesting when you talk about some of the non-traditional players. A few years ago, John Hancock had a huge push with Apple Watch, where they were providing all of their life insurance policy owners of a certain level with the Apple Watch. And obviously that was very data driven, but I think when you start to incorporate, you know, again, this networking of and combining in terms of creating a mutual goal for everyone to come together on, that these players are all going to have to play well in the sandbox together to do that. And there are platforms that are trying to create incentivization through gamification. And then just like what we've seen again with Amazon, right? Just making things easier. So ShareCare is a platform, right? Where you've got prescription services, you've got all your data easily accessible in an app on your phone. You know, you go to the doctor, it gives you lifestyle prompts, just all these types of things that I think are coming. And we're going to see the convergence of all of those things in the next 5 years.
And actually, John, on that point, I want to follow up on what Lindsey and Alfredo says. The WMC IoMT can be seen sometime as a kind of an extension of how healthcare is done. But I think people are missing the point that it can be a really profound transformation. It implies, for example, moving from healthcare to sick care. That's not been the case traditionally. It implies going to home health. That hasn't been the case. Implies bringing coaches to deal with those amount of data and inputs. Never been the case before. So if you move into a care that is kind of following the 3P, like preventative, predictive, and personalized, that's the antithesis in so many ways of how healthcare is being delivered today. So it's not just a slight little extension. It's really important to understand that it can be a real profound way of shifting how healthcare being approached today. When you have $4 trillion of healthcare bills every year, you have to change the system at some point. And I think that's the COVID is trying to door to really redesign how we think about our life and our health.
Yeah, I think that's a great point, Fabien. And something I do want to touch on here in a minute is the actual economics, you know, behind the industry and how that needs to change. But Balint, want to go to you. And, you know, Alan raises a really good question about chronic health conditions and how we can manage chronic health conditions differently and propose new solutions that are buck the status quo and new ways to think about care that are different. How do you think about that from a product perspective and what these, you know, end user patients need and then their care providers need, whether that's a physician, whether it's a health coach, whether it's a dietitian? How do you think about that from kind of a product infrastructure technology perspective?
Yeah, so despite the IoMT market annual growth rate of 20%, we can see challenges to solve during the next 5 years. What you already mentioned, many structural changes and technical changes as well. So nowadays we have infrastructure challenges as well. So nothing is ready long-term goal. If you talk about the IoMT architecture, we have the edge level, like Wi-Fi, Bluetooth, GPS, smartphones, and watches, like things around the user, the endpoint. We have the fog level, which is the local servers, gateways, and we have the cloud level, the data storage far away. And we can see barriers on all these three levels today. So first, we have to solve these technical problems to have a seamless solution and the seamless user experience for the patients and for the doctors as well. Because if you talk about digital solutions based on sensors and IoMT networking solutions, then the speed and the seamless connection, seamless data flow is a must-have, because it's about the trust of the users, and without a seamless service, we can't have that trust, especially from the elderly or less tech-savvy users. We already talked a bit about the 5G. So before the 5G will be accessible, it's really hard to provide a seamless machine-to-machine solution. And nowadays we can see really high costs of different IoT solutions and infrastructures, and this is why the migration to the cloud is quite so slow, especially in the enterprise and healthcare space. We also can see steps like just fresh news is that IBM spin off its legacy infrastructure business and fully focuses on the hybrid cloud solution. And Microsoft also really focusing on an IoMT solution built on Azure. They definitely would like to beat the market leader Amazon Web Services. But on the other hand, Google and Apple has an advantage having the health applications on the mobile phones, which are really close to the users and the potential sensors. So we can see the evolution, but we definitely need this 5 years for the technical transformation. And a good news is that Moore's law is true in IoT as well. So we can expect an exponential growth in performance and in price drop as well. So during the next years, we have to keep an eye on the technical improvements as well, not just the economical and professional transformation.
Yeah, I think that's a really good point. I think you used the word seamless, and I don't know that there's a single person on this call who would say that our healthcare experience today is anything close to seamless. And as I think about, where the industry sits today with, niche solutions and applications popping up, it's hard to see, how it could be seamless. A patient who has COPD and diabetes, what are they going to have? 2 different apps on their phone and have to log in separately and pull different things from each app. It's not going to happen. So I think that's an interesting point that relates to the players you said who have, an advantage, being the Apples, the phone carriers, where everybody is staring down at their phone every day. If these carriers and device manufacturers can figure out how to connect the pieces in a seamless fashion, I think that is going to be exciting. And I do think that is where over the next 5 years we're headed. But that piece of seamless, if we're there in 5 years, we've done a great job, because today the industry is not seamless at all, and it's very complicated. And I think Fabien, you started to kind of go here when you talked about the finances of the industry, and I think there's an interesting statistic that many of you may have seen, but in the United States, the Medicare program is the largest payer for healthcare services. And for the first time in 25 years, we only have 4 years of solvency left in the Medicare trust. The only time in that 25-year window that it's reached that was in 1997, before the federal government passed the Balanced Budget Act. So I think, needless to say, we are in for some change when it comes to the funding mechanisms of healthcare. And that can either come at the benefit of the IoMT industry, or it could be at the detriment if it's not solved in a timely fashion and fundamentally reshaped. So Fabien, do you have any thoughts on kind of what the next step of the business model evolution might be in the next 5 years?
Yeah, I think I've been thinking a lot about it, because you're right that the model, the way healthcare is structured today, as we discussed previously, is really structured to sick care and to acute care, back to Lindsey's point. And so now if you have a healthcare that's going to move into wellness and fitness, as Alfredo also mentioned, how going to have insurance providers? There's been some plan, an attempt to use Fitbit as a way to lower the premium on insurance level. And I think in New York, a lot of people were walking their dog with a Fitbit attached to it. So I think we're not there in the system. I think there's a lot of people trying to hack the system all the time. So how are you going to create new incentive to align the care of the patient with the care of the patient? And could we have maybe different ways to really don't have those acute systems that are very expensive at the end, but maybe a better distribution and maybe better premium based on your health? There's been some health plan that's been trying to address your premium based on the fact that how many push-ups can you make. So I think we're trying to see that notion of like, how can we really all align really in the end, the insurance and the patient, and maybe shifting even further by changing a healthcare that is surrounded today or centered around hospitals and mostly insurance, because they're the payers, to a more patient-centric approach, which is what is so fundamental to change the paradigm of business model and include, also as Lindsey mentioned, the patient and journey of become more health conscious and therefore more responsible of their own health.
Yeah, I think that's a great point. Would love Alfredo kind of just jump in here, but I do want to highlight, that the economics do drive adoption and change. And so while I mentioned that hospitals lost $320 billion, the top big five commercial payers in Q2 alone made close to $17 billion in profits. So there's a clear economic misalignment that exists, and to be able to move that needle from sick care to well care, something's got to change. But Alfredo, would love to hear kind of how your clients are thinking about navigating this, as well as how they're thinking about the business model and the funding mechanisms.
Yeah, I was going to add on also in terms of some of these drivers for that business model evolution. You and Lindsey touched on it, kind of what Fabien was saying as well. It's just a lot of these new entrants. So it's going to be technology, it's going to be retail, right? So Sam's Club just announced they're going to be offering $1 televisits. Obviously, their business model, it's a relationship with Humana, but they also have a different monetization model than the typical kind of fee for service. So that type of business model kind of innovation is really going to push the industry. I mean, if you can get visits for $1 and they're monetizing somewhere else, what is that going to, what's the impact going to be on the provider kind of system, and how are they going to have to evolve? In terms of just like thinking about different models or working with some of the solutions out there, I think a good example is Lyft and then Uber. And then John, you and I had some conversations with some of the leads there, but the lead that was at Lyft then kind of went over to Uber to build out their healthcare transportation business. And what they were looking to do was really partner with health systems. And if you look at their marketing and the way that they position their value, it's to get patients to your clinic visit, to your doctor, to the hospital. At the time, I know Medicare Advantage now is reimbursing for transportation. At the time, there was no reimbursement for that. And a clinic actually couldn't pay for it because of Stark Law regulations. So they were kind of going to market with this solution where, yeah, it makes sense, but the reason individuals can't get to their visits is because they can't afford a ride or they don't have rides. So they're not going to be paying for the ride. However, we kind of worked with a couple of health systems that did partner with Lyft. And what they realized what they could pay for is for patients to leave the hospital. So that really helped them from a discharge perspective and kind of increase cost efficiencies. But it wasn't an initial business model that kind of Lyft was thinking about. And kind of reevaluating that relationship and how you work at that was a good example.
Yeah, I think that relationship is really important. And it brings me back to Lindsey, something you said to me earlier this week, and I think everyone on this call would agree that we need healthcare to be more personalized and more individualized to the individual person. And today, your health data is not really owned or managed by you. You've got data that lives with whoever your insurance company is. You've got data that lives with whoever the physician is that you've seen, whoever the hospital is that you've seen, and likely, much to many people's chagrin, pharma companies likely have your information. And you really have no insight into who has your data, who owns your data, and how they're monetizing your data. So Lindsey, would love for you to kind of speak to the idea of, we saw this rapid adoption of technology with electronic medical records and health systems, but how do we move to a more person-centric view of our information and control of where our data lives?
Yeah, it's an interesting conversation we've been having for years. So especially with my background in the genomic space and having full view of how much of that data gets utilized and sold to pharma. And obviously a lot of it's de-identified, but it's still technically your data, right? 23andMe can keep their costs down because they're selling your data. So it's a very basic business model that I don't know that every consumer is necessarily aware of or necessarily actively consenting to. And I think part of that de-identification process is playing a role in that. But what we discussed the other day is this idea of, we have a social security number, we have a telephone number, we have all this stuff. What if we actually had all of our data and information tied to an individual, healthcare number, and we had a system where in a perfect world, you could consent openly to accessibility or comfortable levels of accessibility for your healthcare, provider, pharma, drug discovery, any kind of, even just marketing or research to access pieces of your data. And what if that was monetized to the patient? Like, what if a patient actually had control, and every time, a pharma company wanted to access your chart because you had diabetes and they wanted to pull your profile in a de-identified manner, you got paid 50 cents, right? I think it's a really interesting way that now patients are much more aware of all the ways that their data are becoming more aware of all the ways that their data is going to be used. And the more data that we continue to provide, I think the more awareness is going to grow from that. And I think there's an acceptable level of data that people are willing to give up. But as we've seen with backlash, even with the big tech, with Google and Apple and everything else, there is a point at which consumers say, I want the choice. I want to control what data I offer up and how it's utilized. So I think it's really interesting to start to play into all of these, Internet of Medical Things, API, all the plugins, wearables, everything else, to say who's controlling that lever, and at what point do we give the patient the right to their own data, especially as genomics and personalized medicine continues to jump to the forefront.
Yeah, I think that's a really interesting topic. And I think, in society, we're seeing kind of it go two ways. We're seeing folks that really want more control of their information, and we're seeing folks that basically are saying, my information's already out there. I'm done worrying about who's got it. I'm going to set up, protections for what happens when something bad happens with my information. And so I do think we're at kind of a pivotal point, which Balint leads me to a question for you around security. So I think we've all probably heard that some of the most valuable data on the dark web is healthcare information. And the folks that are buying healthcare information, it's really interesting to me, trying to figure out what they're using it for. But there is obviously significant dollars tied to this, what's hacked in most cases, information. Balint, how do you think about security as we continue to create more and more health information?
Yeah, thanks. And as Lindsey mentioned, more and more people are aware what's happening with the personal and medical data, and IoMT doesn't make it easier, this situation, because we used to have such amount of health data, but in the near future we will have more and more data generated by different devices at different places, like at home, in wellness, in healthcare, and so on. And the management of this data set is more and more complicated. So it's really really important question: how to make the personal data secure, and how to make it the own data of the user again, because it's needed to gain the trust from the patients, especially in the long run, with the new generations who are more active in the data controlling. So, for example, the FDA recently released an industry guideline for the security of medical devices, and there are many issues, like just during 1 month, nearly 1 million people lost the health data from different hospitals. So it's a real danger, and on one hand, we need to solve it with the infrastructure, with the proper security and software solutions. On the other hand, we have to control it by the processes and the rules which are applied in the institutes and in the everyday life, like how people are using their own devices, how people are using their subscriptions. So the end users have to be more active in this field, because we can't wait the solution from outside, because if I have my own devices, if I have my own subscriptions, then I have to be an active part of it. So I think, especially with the elderly people who are not used to this tech-savvy solutions, it's a really challenging thing. So I believe that education on the patient side and on the health workers side, both really important, and to have the right talent within the IT staff, it's also really important, because someone has to understand the problem, has to educate the other departments, the other stakeholders.
Yeah, I think that's right. I think the really interesting thing for the folks on this call is I think that fundamentally security has to be a part of any solution application you're thinking about. Because if you want to know the fastest way to get thrown out of a customer's life, it's by letting their information or having a lapse in security. And especially as an early stage company, that can be a big challenge to invest your limited dollars to be secure. But I think it is something that it has to happen. So with the remaining bit of the discussion, yeah, Fabien, you want to jump in?
Yeah, just 2 points I just want to add on the following point of Lindsey and Balint meant. I think on the personalization part, I think it's interesting that IoMT breaches really quickly to genomics. Like, there's a new field we created called PGX, for example, means that not every drug reacts the same way based on your gene. I think that's a really interesting one. And on the data privacy side of things with AI now, people see IoMT really as devices, but like we can look at the code that we have now, and you have AI that can rank everyone by mood, heart rate variability, blood pressure, live. And so Facebook, when you upload a photo today, can know your mood and your stress level, for example, and your heart rate and your cardiac workload. So where is the data going, and who owns that data when it's just a photo, isn't it? So 2 points I thought was really on top of what Lindsey and Balint mentioned.
Yeah, I think it's a really it's a little bit creepy, but actually, it's really exciting. It's really exciting in my mind that technology has reached the point that we can create these insights, and I think understanding how to make them actionable and how they can actually drive change is really kind of the evolution. And I think that leads well into
John, I want to add one more thing also. I'll just round it out here. Yeah, so I think with the data privacy, obviously the security, but I agree, individuals, there's a lot of angst on how your data is being used, but then there's a lot of data sources you don't know are even being used to Fabien's point. It's interesting though, who people are willing to share data with. So if you look at a survey, people trust their and if they look at the healthcare ecosystem, they probably trust their doctor the most. They trust insurance companies the least. Insurance companies have the most amount of data on you, and your doctor has the least. And another kind of interesting fact around that too is if you live in the United States and you have commercial insurance, there's a very good chance that your commercial insurance carrier also buys your credit card data and compares it to kind of your actions. And I think it just, as we think about data portability, the ability to meaningfully share data with the individuals that are needed to kind of make those decisions is going to be key. And then thinking about any adverse impacts. So, it's great that payers have this data if they can affect kind of healthier outcomes, but it's maybe not that great if they're going to use it to kind of deny coverage. So,
yeah, I think that's an interesting perspective. I think denying coverage is one thing, but it is interesting. If you wanted to drive real behavior change, start changing the insurance premiums to the lifestyle that you're living. And while some folks, genomics may not allow them to be as healthy as others, I think as this industry evolves, there's going to be personalization on that side as well. I fundamentally, this is an opinion, don't believe that my insurance premium should be higher for all the people that smoke at my company, where the data has shown for 30, 50 years that smoking is not a good thing for your health. But I'm paying more money because I'm insuring essentially those folks who are likely to have a more serious event. It's obviously a hot button item, but I do want to kind of pivot and end this kind of discussion really speaking to the value proposition of the industry as a whole. And Lindsey, you've obviously with your company that you're working on thought a lot about this and thought a lot about the go-to-market strategy, and is it B2B, is it B2B2C? What is the best kind of way to position your solution? But would love to hear how you've kind of thought about that with your company.
Yeah, I think the thing that we talked about a lot, and actually all of these factors have played in so much, especially the last one that we just touched on with it, which is insurance. Trying to build solutions on an old model that we know is broken and we see and identify gaps that we can solve for, while still maintaining enough innovation that we are looking towards a new model, right? Because we know the old model is not sustainable. And even in something as simple as advanced diagnostic testing, where you have decent reimbursement and the reimbursement's actually higher than what you could offer as a cash price, but it lowers the accessibility because of not just the higher premiums for people to have coverage, but the extremely high deductible plans that we're seeing consistently these days from patients. So, I think when we're talking about all of these things and how it plays in, of really identifying what our goals were as a company, and so we've kind of created a little bit of a mix, right, of this B2B and B2C, but primarily the goal was to provide consumers access to direct their healthcare. An interesting thing that's happened with the internet is, and I actually laughed about this with Jeff Arnold prior to COVID at an event, but WebMD became the kind of joke of like, oh, patients go online and think they know everything, right? Because they can look up their symptoms and self-diagnose and all that. And that's yesterday's news. But today's story and tomorrow's story is patients really actively directing their healthcare specifically. And I think that's, where we're trying to look and say, how can we do this, providing this access and at the same time maintaining an opportunity to have a care continuum where we're not isolating people, as we talked about earlier, into, one chronic condition where they're not talking to anyone else. And I think it's a really interesting challenge that we're working to address in our particular space. But I think everyone is kind of looking at that and facing the same challenges as well. Of what is the best answer? And everyone's going to have to, think about what their goals are and find a solution that works for their system. But ultimately, it's going to be interesting to see how this all rolls out.
Yeah, I think it's a really exciting time, and really excited to watch kind of your success as you navigate it. Fabien, you've obviously, been with a startup that grew to a large company, and now you're kind of going back and saying, where's the opportunity and what's the next problem or the pain point that you want to solve personally? But how should, all the attendees on this call, whether they're entrepreneurs or investors, kind of be thinking about that fundamental question, at least how you're processing it?
For sure, great question, John. I think the part is a word that I think is really important, that in that whole new field that I think we touch upon in different ways that is critical, is the word trust. So how are we going to build a trust around the relationship? How are we going to trust the trust between the physician, the insurance, and the patient? So I think trust is a really key one. And the second one is really, there's been a world of healthcare that's been like 99% skewed or over-indexed towards sick care. And you have this like blank slate now of wellness and fitness and preventing care or preventing to be sick that is basically open blank field. And I think that's what is really exciting, is how to tackle it. I mean, Lindsey, clearly I have been working some approach, and it goes really far, because it doesn't just go into IoMT as devices, but now it's going to clinical trials as well. So they're being totally transformed as well. And the point Alfredo is mentioning as well is really right. Like YouTube, for example, is really monetizing the number of times you go and clicking on a video. So how come and when is it going to be a new business model being created around this notion of like, your data will also be monetizable in large volumes as well? So I think there's a lot of really open, really fascinating opportunities to go into that really fill that blank slate that will all benefit all of us in so many ways.
Yeah, I think that's right. And I think you hit on a pretty important topic that the innovators on the call need to understand, is you've really got to be solving a pain point. And you've really got to be very critical of your own business models to understanding what is that pain point and am I actually solving somebody's problem? I think there's an example of what I would call an early stage, what was an early adopter of kind of this IoMT concept being Proteus, the digital therapeutic company, raised almost $1 billion and filed for bankruptcy this year. And I don't think it was for a lack of great innovative technology and vision for the future, but the reality is the pharma companies, the physicians, and the other stakeholders in the equation couldn't figure out actually how to deploy it to solve an existing problem. In my mind, it was just technology that was a little bit too early, and their patents were acquired by a number of different companies. And I am of the belief that we will see them, those technology patents, coming back in the future. But it's a great example of a really innovative company that raised $1 billion of private capital and was valued as a unicorn at one point, filing for bankruptcy this year. You've really got to understand the pain point. And I think, Alfredo, would love for you to kind of provide some perspective here. When I think about innovators and disruptors in the industry, they're all pretty much trying to eat your customers' lunch. And the failures of your customers are really the opportunities for the innovators and the disruptors in the industry. And I think it's been something that I've seen has been an ongoing challenge as to how do these entrenched bureaucratic stakeholders evolve to push our industry forward. They're obviously a very important component, but history would tell us they're not the best at innovating. How do you think about that? How are you helping them position themselves?
Well, first, I think the innovation is really going to come from entrepreneurs, right? And some of these market forces are probably going to push the incumbents to start to adopt those solutions. One thing I would say as you kind of think about, what's going to be impactful, what's really going to move the industry, taking a solution and trying to move it by 10% and doing something 10% better is not going to transform the industry or kind of really reduce costs. I think Lindsey was kind of touching on this too. You really need to go big. Think about what the big picture is. So Proteus, they kind of started with the big picture and they really fudged the execution and really kind of thinking about the business model. I think people go the other way also. They kind of start in current state and then just figure out in current state, how can we do things a little bit better? So I would really advise kind of the entrepreneurs and kind of everyone on this call to really move the industry, think big, don't just try to improve 10%. The other thing that's interesting too, is if you're thinking big, it's easier to raise capital, then everyone is playing in the 10% space. So if you kind of get out of that space, you actually create less competition.
Yeah, I think that's an interesting kind of perspective on thinking big, thinking disruptive. But I think the other thing that's, I've seen firsthand is there was, a massive influx of private capital into the digital space over the last, call it 7 to 10 years. And you saw all the, what I called earlier, non-traditional players all of a sudden had large healthcare verticals and we're starting to compete in this space. And you saw a lot of folks who had typically been in tech in San Francisco or had come from other industries jump into healthcare and develop great technology solutions that just weren't applicable. And they didn't understand the complexity of the stakeholders that exist in the healthcare equation. So I think that's one thing that's top of mind to me as I think about innovation in the industry, is making sure you really understand how all the players interact today. And even if you're trying to disrupt them, I think you still have to understand where they play, because if you just discount them, it's likely going to come back to bite you in the end. So I'd like to kind of bring our panel home here with one last kind of question, and it'd be for each of the panelists to kind of give, if you had to give the entrepreneurs and the investors, one lesson learned or one piece of advice as we think about, what is a really exciting space that I believe has the ability to fundamentally reshape how healthcare is delivered in the United States, what would it be? And Fabien, we kicked it off with you, and we'll start with you.
Thank you, John. It's hard to maybe summarize one, but I think there's like a little few rules that are really important, as you mentioned, to not create what's called TLA, technology looking for applications. I think pairing clinician and technology people is very important. Not going for the product, but choosing a very big market. Alfredo is mentioning to be able to 10x. I think those parts are really interesting. And one piece of advice I think is really helpful on those need finding journey is to follow the Stanford Biodesign program, which has really created a framework on how you really do the need finding in healthcare and don't approach this from a tech standpoint. So that could be just valuable, I think, for anyone entering the space.
Great, that's very helpful. Lindsey?
Yeah, I mean, I think we've touched on so many of these points, and just to kind of maybe narrow it down to one or two things to call out. I think, remembering that access is key. And to your point, just engaging all the stakeholders. And one thing I've seen consistently, especially in the digital health space, is that when there's a lot of disruption, often the keyhole or the stakeholder that is, most often ignored is the physician themselves, right? With this direct to consumer push, a lot of times we're kind of bypassing and ignoring, and that is an obstacle that people, I think, need to overcome. But to a certain extent, physicians are such a key role in the entire healthcare industry. We can't leave them, no amount of technology is going to completely replace them. So making sure that we engage them early because we need them to be early adopters.
Yeah, I think that's a great point. And it's interesting is, many times innovators try and avoid or steer clear of those that are most threatened by their disruption. And I think really to reach adoption, you've got to charge at those threatened stakeholders to understand their perspective. You may still be going after and trying to eat their lunch, but avoiding them doesn't really, solve the piece of the equation. Balint?
I would like to join to Fabien's and John's points. Within the IoMT space, if entrepreneurs and investors would like to decrease risk, then they should check whether their solution is already technically viable with the current infrastructure, speed, and price. So not just from an industry perspective, but from a technical perspective, it also worth to be a bit careful and to count with the steps. Not just the long-term vision, but a bit the tomorrow's solutions as well. And we talked about security, and for startups, I believe that it's especially important because a fatal risk can be if there is a security problem. So investing a bit more into stability rather than just the rapid growth. It may pays off, and we talked a bit about the users, the user-centric IoMT solutions. And if we talk about IoMT solutions, the user experience must be a key, both for the patients and for the healthcare staff. And the design of it is a bit challenging because we can't just focus on one application, but we have to focus on the whole process, from the sensors through the whole way of the information till the processing and the actions based on the data. So the user experience design should cover this whole spectrum, and to help the actual users, whether old people or professionals. So this user experience focus also could help a lot if we talk about successful IoMT solutions.
Great. And Alfredo, we're leaving you to bring us home and wrap us up here.
Well, I already used my Go Big pep talk, so that was kind of holding that for the last piece here. No, I mean, I think, it is, incremental change isn't going to move the needle. Go big, figure out what the steps are to kind of get to that end state. And that really that really involves understanding the ecosystem. Healthcare is I like to say two things, intricate and intimate. So it's very intricate because the paying mechanisms, who's making decisions, it gets very complicated as you think about family members, payers, providers, and the like. And then it's intimate, and you can't forget the fact that this is about people's health. So as people are making decisions around their own healthcare, it's a lot more than making a decision around, like a social media platform, like what to watch on Netflix, for example. Hopefully they're taking it more serious than Netflix. But anyway, that's my spiel.
Well, I want to thank, first of all the panelists. I think your perspective was really appreciated, really helpful. I know I could talk about this the rest of the day. I'd like to thank the attendees for joining us this morning. And I would like to kind of leave this group with one thought, and it's really that, healthcare is too important to stay the same. And I think it's work groups like this and other networking opportunities and all of us as, key stakeholders in this equation to really drive that change. So I'm very excited by the discussions that we're having. Happy to help anyone that's a part of this networking group. And with that, we'll turn it back over, I think, to Balint or Sandra for our next topic.
Thank you so much, John. Great discussion for your panel. And I really enjoyed that, and great job moderating. So let's kick off the next part of our time together, which is the Telehealth Startup Award. We have, this is hosted by the Telehealth Networking Club. This is the October Telehealth Startup Award. My name is Sandra Miller. I am CEO of Runway Innovation Hub in San Francisco, and I'll be moderating the Telehealth Startup Award. And just to quickly mention a little bit about my background, I'm also a venture partner with Fresco Capital. And Fabien in the last panel mentioned Stanford Biodesign. Healthcare is really one of my first loves, and I am actually co-founder of the Stanford Biodesign program, which is still going strong some nearly 20 years later, and with people inventing things that are impacting patients all around the world. But there are some really great methodologies there. So thanks, Fabien, for the shout out for Stanford Biodesign. So enough about me. Let's get started to meet our esteemed panel of judges. So first up, we have Michael Koutsadakis, who's Vice President at Paulson Investment Company, Oren Ioni-Charas, who's CEO of the Global Health Impact Fund, and Balint and Dr. Faz Bashi, who's wears several hats, but he chairs the Life Science Angels Digital Health and Sciences Screening Committee, among others. And Balint Bene, who's founder CEO, as you know, of Bene Studio. So I'm going to now ask each of the judges to quickly introduce themselves. And I'll start with Michael. If you could give a brief introduction.
So So again, I apologize if, can you hear me right? Because I've got my headphones. Okay, brilliant. I'm a vice president of investments over at Paulson Investment Group, and I'm going to be the troglodyte and neophyte here. So this is my first salvo into participating in something like this. So hopefully, I'm praying there'll be some constructive developments that I'll be providing. But grand scheme of things, my firm focuses on healthcare. We do smaller raises between $5 and $20 million. So between the contacts that I have and insights that I've garnered over the years, I'm hoping that there'll be, again, some utility that I can provide to the assessments.
Terrific. Thank you, Michael. And just to give you some feedback, when we're giving feedback, your volume's going to need to be a little bit, you're going to need to speak a little bit louder.
Oh, sure. Okay.
All right. Thank you for that introduction. And Oren, can you briefly give us a little bit of background about you?
Yeah, hi, good morning again, everybody. That was a great talk earlier. Thank you for that panel. So my name's Oren Aloni-Charis. My background is that I'm an anesthesiologist, 25 years in clinical practice. I work in the Bay Area, and I'm also the managing partner and CEO of the Global Health Impact Fund, and we invest in early stage healthcare companies, including in the digital health spaces and devices.
Great. Thank you very much, Oren. And do we have Foz?
We do.
Fashi?
Can
there
you
we
hear
go.
Me?
There he is.
Yes. Hi, everyone. I'm Foz Bashi. I'm in the San Francisco Bay Area. I do wear many hats. I'm a physician, scientist, investor. Life Science Angels is the group that I've been with for over 10 years. And I am an affiliate partner with Boston Millennia Partners, and it's purely a digital health private equity fund. And I'm also one of the lead venture investors for Portfolio's Femtech fund, focused on women's health and wellness. Yeah, and I'll pause there. And I'm also into animal health, so that's why the dog is back there.
Foz is famous for having some of the best backgrounds on Zoom. So I always love, one more reason I always love having Foz on the panel.
Thanks for having me. Yeah.
And then Balint, for those who are just joining for this section, can you give a quick intro?
Yeah, thanks. Hello, everybody. My name is Balint Bene. I'm the CEO of Bene Studio, and Bene Studio is a digital product consultancy. We have a special focus on Healthtech, and we delivered more than 100 premium quality mobile and web applications, and we integrated systems both for enterprises and for startups. So today I would like to share my product experiences and also to learn from you. And this event is about highlighting your products and supporting you. So this video after this show will reach several thousand viewers. So I hope everybody will find this session as useful as myself.
Great, thank you, Balint. Okay, so we have 4 fabulous startups who are going to pitch today. We're going to have Alan Gale, CEO of Aimee Health, Prasheta Sahu with AidMedx, Ann Mompara with the Chief Medical Officer of Intiva Health, Craig Lamoli, founder and CEO of Wellsheet. Let me walk you through how our session today will run. Each startup will have 4 minutes for their pitch. After, and I'm timekeeper, by the way. I have to grab my trusty phone. And so I will be calling time. Sorry, we'll be calling time. After the pitch, I'll ask the judges if they have any questions for the startup from their pitch. And also we like to give feedback because we're all learning, right? And we know that it takes many, many times to really dial in your pitch. So we all can benefit from feedback. And so the judges are doing this in part because they love to learn from you, startups, and any way that they can give back in terms of feedback to help you improve your pitch. I know that they will do that in a very constructive but friendly way. And so after the Q&A, I'm going to ask the judges to score the pitches, and they're going to do a live call out, holding up fingers or shouting out their votes. We're going to make sure that we get the score from each of the judges. And then at the end of the session, the startup with the highest score will be announced as this month's October's telehealth startup. And that startup will receive a planning session with Bene Studio to enhance the development of their product. I think everybody can get excited about that. And in addition, you can also take advantage of a one-on-one coaching session with me. And I'll send you an info. There are a lot of different topics we can cover in that coaching session. We did that last month, and that was really a blast to get to have more time with the winning startups. And then also all of the startups today are eligible for a free product discovery from Bene Studio. So lots of good stuff. So let's kick things off. I'm gonna now ask Alan Gale. You're gonna be up first. So Alan, if you could share your screen, get your slides up, and come off mute so we can make sure we can hear you.
Great, can you see the screen?
I can see the screen. You're not yet in present mode, but I'm sure you're working on that, and I could hear you.
Says I'm sharing.
You're sharing, but your PowerPoint is not in present mode.
That's true. Okay.
Yeah.
Let me just get that.
Yeah, there you go. Okay.
Okay, great.
We're perfect, and I will start the timer when you start.
Okay, so my name is Alan Gale, CEO of Aimee Health. I'm an MIT-trained engineer and a biohacker, honestly, since I was about 10 years old, and that's another story. I've worked as a communication systems engineer and satellite and Wi-Fi and cellular systems. And when I sold my last company, I wanted to combine engineering with biohacking, when Aimee Health is a result of that. So Aimee increases health span with nutrition. We have close to 500,000 people are dying every year for preventable reasons. 30 million people are diabetic, another 100 million are pre-diabetic, which is largely reversible. 133 million people have 2 or more chronic diseases. And the problem essentially is that nutrition and medicine are disconnected. We follow food protocols to understand what we're supposed to eat. We don't really know if they're working because we don't check our biomarkers against those protocols. We go to the doctor and we have blood tests done, but we don't know if those results are because of a problem with our body or a problem with what's going into our body, namely our foods. So on a fundamental level, do we even need supplements? And if we take them, do they work? There's 450,000 nutrition studies that talk about a problem with deficiency and excess of different nutrients. Quarter of us are tracking our diet, but we're tracking calories, not nutrients. Half of us are taking supplements, but we're basing our decision on marketing and not on science. So we have a different methodology. We start with a quiz to assess the need, which looks at basic biomarker data, symptoms. We use science-based protocols to create a personalized action plan. We incorporate third-party products, including foods, supplements, and biomarkers in order to validate that those protocols are actually working. So we simplify everything down to a set of photographs of your food. And with AI engines and nutritional database lookup, we can identify up to 132 nutrients and identify risks and then make recommendations. Our business model looks at this ecosystem of individual participants that are out there, that each of which fill an important role, but that are not integrated together. So we start with thought leader programs. We have an immunity program based on really strong science that allows that program to be licensed by practitioners to use in their practice, either to assign to a patient with videos and exercises on a DIY basis, or to be implemented in a group coaching environment. The practitioners benefit by a 10x improved speed in analyzing and acquiring nutritional data, as well as a turnkey revenue generator for them with the programs that we offer them, as well as other services that are more of their traditional type. For the patients, they get a 360-degree solution. Very simple dietary analysis. We address the social and habit forming issues through the group coaching program and through other methods that we're incorporating. In terms of our competition, there's other companies out there that certainly sell supplements, but they do so blindly. They may be medical grade, they may be third-party tested, but they don't incorporate biomarker testing. They don't incorporate food tracking to understand if the supplements are needed and if they're actually doing what they're supposed to do. And we're faced with this very serious problem in the marketplace where we have these great biomarker tests that look at the effects of metabolism and DNA and gut microbiome and how they affect our body, but they don't fill the gap to understand the driver for those results, which are the nutrients that we get from our foods and supplements. That's the big missing piece in this big health equation.
Alan, I'm sorry, but you're out of time. So can you just give us your ask? What are you asking?
So we're raising $2 million on a seed note, and about $1.5 million of that is already committed. And this is on a safe note with a 15% discount, $4 million pre-money valuation. So together and separately apart, let's make America healthy again. Thank you.
Great. Thank you very much. All right, judges. Let's see. Any questions for Alan?
I'd like to start. I have a question about the last slide. This is Oren. Alan, thanks for the presentation. It was interesting. I apologize for our short timing. I would have liked to see more about the biomarker information you were going to present. So just as a recommendation, I would get into that when you're on a time constraint much faster, because that's probably what's most unique. The thing I wanted to ask you about was your valuation and your raise, because that's a financial question and has nothing to do with the actual functioning of your company, but financial risk, financial opportunities is one of the top three things that an investor would consider. And what strikes me as odd is that your pre-money valuation is $4 million and you're raising $2 million. That's a lot of your company that you'll be essentially, selling to, well, on a safe note, but selling away. Why are you needing that much money that early on? Why is your valuation so low, with respect to that? And are you taking in more money right now than is reasonably appropriate given your valuation?
Well, and I'm sorry I had to run through that slide very quickly. So it was a market cap, it wasn't a valuation. So meaning that would be the worst case for the investor in terms of, for us in terms of what the valuation is. So in other words, on a safe note, the value for that investment will be determined at the Series A. And so it would not be worse than a 4 million cap. It may be higher than that. So in other words, if we raise 10 million on a Series A, the 2 million that we do now on the safe note would represent 20% of the company.
So you're not capping the valuation on your safe note. I'm sorry if I misunderstand, because that's, and please nod your head, colleagues, if you disagree with me. Usually when we talk about a cap, we talk about the highest amount that the company valuation would be at the time of the conversion for that equity.
Correct.
So when you say it's a $4 million valuation, that means that my investment will, if your valuation at the Series A is higher, I'm converting at 4 million.
No, No. So, and I'm sorry if I wasn't clear in how that was depicted in the slide. So if we're raising a 10 on a Series A, the 2 million would be 20%. If we have a problem on a Series A, for example, and we only raise at 4 or raise at 3, you would receive 50% based on the 4 million cap.
Okay. Yeah, I think
yeah. So great that you brought that up, Oren. Michael or Foz?
Yeah, sorry, go ahead.
Balint,
do you want to go?
Just a quick question. So you solve a real problem, which is great, and you already generate income from this service.
So we actually are just launching with the practitioner program in the next few weeks. We pivoted from last year being focused in brain health on a direct-to-consumer offering, and we moved into immunity after COVID hit, and we started working with practitioners almost immediately who said, this is really great what you guys have put together, and we're very interested in incorporating this in our practice. How can we do that? So we started bringing on practitioners. We brought on a few dozen already in the past few months, just using our quiz and our mobile app for dietary analysis. And everyone that we talked to so far wants to start using our licensing program with their patients once we launch in the next few weeks.
Thanks.
Great.
And do we have time, Sandy, for another
Yes.
question? Yeah,
Yes.
Can you just briefly outline what is it that you're protecting here? What are your picket fence protecting? Is there intellectual property that you're filing? Are there picket fences that you're putting here? There's lots of noise in the space.
Yeah, so we haven't patented any of our technology. We're using proprietary algorithms. We are another thing that's quite valuable over time will be our predictive analytics by access to the data that measures the ability to predict bioscore and health concerns using dietary data.
Okay, thank you.
Great. Michael? You're on mute.
I just unmuted myself. Can you hear me okay now? Or?
Yes. Yeah.
Right. It's nascent at this point, so I'm probably getting ahead of myself. But what are your exit expectations? It's a seed round. You still have to do Series A, probably Series B. What's the end game and the timeline for when you expect to be acquired or IPO or what have you?
So I would say probably about 5 years or so, we would be either in a position for a significant exit with a payer, for example, or with other medical institutions that want to incorporate the algorithms and the methodology within their practice, or potentially even an IPO.
Great. All right, judges. So right now we need a score from you from 1 to 5, with 1 being the lowest and 5 being the highest. So if you could all just put up your fingers or and tell us your score for this startup, and then we have folks who are getting the notes. Balint, we need yours as well. All right. So we got a 4, 2 3s, and Michael, you were a 3. Yeah, great. 3 3s and a 4. All right. Thank you so much, Alan. Great job. Next up, we have Craig Lamoli with Wellsheet. Craig, can you come up and put your slides up and come off mute as you do so?
Yes. Hi. Can you hear me?
Yes, can hear you. Thank you.
Great.
Are you ready to go? And I'll start the timer.
I am. Hi, everyone. My name is Craig Lamoli, and I'm excited to present Wellsheet to you today. Wellsheet is a predictive clinical workflow platform that radically improves physician efficiency. We sell Wellsheet in a software as a service model to health systems, which pay a per user per month subscription fee. And we have distribution partnerships with the major electronic health record vendors to bring this to the market that represent over 85% of large health systems. We've raised about $6.5 million to date with our $4.3 million Series A round closing earlier this year, and have existing clients, including over 40 hospitals. I founded Wellsheet after working at IBM in their Watson Health division, where I gained an appreciation for the immense frustration that physicians faced with existing technologies, especially the EHR systems. I dropped out of Wharton to start Wellsheet in 2016 and was fortunate to team up with experts like John Paul and Dr. Fred Lindbergh. John Paul's our CTO out of Amazon and Betterment, and Dr. Lindbergh is a rare MD PhD engineer out of Flatiron Health. Our advisors include thought leaders like Dr. Christine Castle, who served in the Obama administration, John Glasser, who was CEO of Siemens Healthcare when it was sold to Cerner for $1.3 billion, and Georgia Papa-Thomas, who was the CIO of Janssen Pharmaceuticals and SVP of Data Science at J&J. The problem we're solving is that EHR design flaws impede physician workflow and obscure important clinical information for treatment decisions, costing our healthcare system billions of dollars each year. Our mission is to transform the way that physicians access clinical information to radically improve the provider experience and health system efficiency. We achieve this vision by partnering directly with the electronic health record vendors and embedding our technology within theirs. Through this seamless integration, we have access to all of the patient information in the chart, and we run this information through our patent-pending predictive models to surface the most relevant content and decision support resources to the physician. We've achieved noteworthy results at major health systems across the country, including RWJBarnabas Health, where we were able to demonstrate a 40% reduction in the amount of time physicians needed to spend in the EHR per patient, and reached over 1,000 opt-in physician users across 7 hospitals. The ROI for these productivity benefits is vast, and just the throughput improvements that we've shown pay for the cost of Wellsheet many times over. Wellsheet's proprietary predictive models are even more powerful when applied across multiple sources, and we are actually now working with the largest payer in New Jersey to be able to deliver insights into the physician workflow around key quality metrics as well. With proven pricing from existing customers, we're able to show a nearly $8 billion market for our technology across payer and provider segments. Our distribution partnerships and flexible subscription model allow us to scale much more quickly than traditional enterprise healthcare technologies, as proven by deals like Concord Hospital, which was a total of a 5-month sales cycle, and Penn Medicine, where we went to production with Wellsheet fully integrated into their Epic EHR in less than 1 month. We're also finalizing distribution partnerships with EHR vendors looking to sell Wellsheet on their paper. With our Series A fundraise complete, we're targeting a Series B for late 2021 after we've achieved these exciting milestones. And we would really appreciate any introductions to physician leaders who might be interested in Wellsheet. Thank you.
Great. Thank you very much, and right on time. So judges, let's see, can you, I'm just trying to pull up my view of my judges.
I can, if you don't mind, I'll jump in, Sandy. So Craig, very nice presentation, and I think you did yourself a favor by dropping out of Wharton. So who needs it? You're doing really well. Congratulations on the ARR, on the raise. I'm curious what COVID is doing to your pipeline at this moment, because health systems are suffering like crazy. Can you just articulate a little bit about how this unforeseen pandemic has impacted your business?
Yeah, so there's been headwinds and tailwinds. From tailwinds perspective, we've actually seen a huge growth in adoption at our client sites as a result of COVID, due to how beneficial the features are in responding to the pandemic. in terms of visibility to every patient across the health system, where they are from a testing perspective, and managing resources accordingly. And then from a headwinds perspective, obviously the hits to the health systems hurt their budgets. And so we've been able to work around that by offering very low cost trials where they can install the product and choose to do a enterprise deployment after seeing the proof with a small number of physicians at a very low cost. And once their finances have recovered. And we're also bridging into the payer market, which is hit.
They're flushing cash. Yeah, they're flushing cash. Just one more, just follow up on that if you don't mind really quickly. So I want to understand the ROI. The ROI is that the notes get closed more often, the notes get completed more often, better decision making, you're providing clinical. So which one is the highest ROI that folks are looking for?
Yeah, so I kind of breezed through that slide, but it was three main categories. The first is provider productivity, efficiency, being able to see more patients. So we showed a 20% increase in throughput. And so that's really significant financial gains by physicians being able to see more patients. We showed a 40% decrease in the amount of time that physicians have to spend in the EHR, which is a huge contributor to physician burnout and turnover. So that physician satisfaction is also critical. And then finally, from a quality perspective, by being able to identify gaps in care to surface to end users for them to act on and have those actions flow back into the electronic health record to kick off the right downstream activity. That also helps to deliver significant ROI for health system customers and ties into that payer model that we're incorporating as well.
Great, thank you.
Great. We actually promised that we'd get Craig out of here right at 10. So we're going to have to cut questions short. And judges, if I could get your help with voting for Wellsheet. So Michael's giving a 5, Oren's giving a 5. All right, you got a perfect score. That's a first for us. So kudos to you. And thank you very much for the great presentation. We'll, we may have a tie, who knows? So we'll follow up.
No, it's a pleasure. I really appreciate the time. Thank you.
Great, thank you. All right, so next up we have Prasheta Sahu, who's founder of AidMedx. Prasheta, can you bring up?
Yes,
I can hear you.
Yes, I'm sharing my screen. So you can see my screen, right?
Yes.
Okay.
All right, you're all set, and whenever you're ready.
Good morning, everyone. I'm Pracheta. I'm representing AidMedx. We are revolutionizing medical imaging through artificial intelligence to save lives. In the team, we have me as a co-founder of AidMedx and the co-inventor of its AI technologies. I'm a PhD student at UT Dallas in computer science department. Dr. Indranil Roy, a co-founder of AidMedx and its AI technologies. He's a postdoctoral research fellow at Northwestern University. Dr. Latifur Khan, co-founder of AidMedx, and he is a full professor at computer science department in UT Dallas. Dr. Hubi Yoon, advisor and radiologist for AidMedx. Dr. Bhavatos Biswas, advisor and clinical expert. Steve Sandquist, CEO. Daniel Brown, CFO. Nirinjani, COO. The big and growing problem in radiology covers misdiagnosis, increased radiology workload and visual fatigue, complex workflow, billing and compliance. And together we have a wasted cost of 7.5 to 12 billion and lost lives and affects the quality of lives. So our solution is a proprietary software for medical imaging diagnosis, which is our AidMedx platform, which has an universal image analysis platform with 99% accuracy, which works across image files like X-ray, CT, mammogram, and with seamless workflow and integration to the billing system. And our patent is pending. We have filed the provisional patent. How the AidMedx platform works, it is very simple. We have our input image, which is a CXR or CT scan for COVID-19, and ultrasound or mammogram for breast cancer. So we pass it through our AidMedx analysis platform, which is a deep neural network platform, and get the disease detected. On the right-hand side of the slide, you can see the full workflow. We have the input image from any internet-connected device, be it mobile or tablet or laptop, anytime, anywhere, and in any format, as many as our client needs. Diagnosis at their fingertips, predict with confidence. So we are saving a lot of time, and in turn, we are saving lives. So our go-to-market plan is something like this. For COVID-19, we are going to market in Q2 2021, breast cancer Q3 2021, prostate 2021 Q4, and diabetic retinopathy Q1 2022. For a bit more about the technical slides, here the mammograms are classified as malignant, benign, and normal. We can identify the abnormalities in breast cancer lesions very well, and well-separated features by our algorithm leads to efficient learning, higher accuracy, and accuracy is 99.4%, and testing time is 6 seconds for 10 images. Same thing for COVID-19 detection from CT scans. Accuracy is 99.42% and testing time is 5.32 seconds for 10 images. Our business model is SAMD revenue model, and which helps radiologists in reaching faster and more accurate diagnosis. It adds to the reimbursement and cost saving for the insurers. So competitive advantage is something like this. So we have 99% accuracy with universal platform with many disease targets. We are asking a seed fund of 2 million with equity based. Our use of proceeds is key member to join the company full time in the process of filing FDA clearance, product development, product launch, and patent has been already filed. So we are waiting to file the full patent after our funding has been done. So thank you.
Great, nice job. All right, judges. Let's, who has questions for Prasheta?
I can kick it off. Very, very nice presentation, by the way, and obviously a great deal of work and effort has gone to a platform. 99% accuracy is huge. What are your current customer types? What is your target entry point? Is it the chief medical officer? How about this? Who is your chief yes officer? Who says yes to a contract with you?
So our customers are radiology clinics, hospitals, and we are in very good conversation from our Indian markets. And we are already signing contracts with Indian hospitals. We haven't signed the contract, and we have very good conversation going on with Memorial Sloan Kettering Cancer Center and Boston University Medical School. So these are our customers right now, and very good conversation going on with some radiology clinic chains as well in USA.
Michael?
Sure. No medical degree and sort of in the dark, but this isn't meant to supplant radiologists, it's a complement to. What is the bifurcation with respect to who would actually look at the data, the image to make the final assessment? So your predictive analytics, 99.4%, the skew, I mean, it's nominal, but is there a second set of eyes, or is it meant to replace the radiologist who would normally be looking at the images?
A very good question, Michael. So basically, we are not replacing the radiologist. We are just helping the radiologist. So for the young radiologist, it will help as a confidence booster because they probably has not seen as many as radiographs in their entire career, as many as we are training with our machine learning models. And for veteran radiologists, it will save a lot of time because our machine learning platform can analyze thousands of images with just 1 hour. So basically it will be using as a confidence booster immediately, and we will enhance the radiologist, but we will not replace the radiologist. So radiologist will take the ultimate decision.
Great. Oren or Balint? Oren.
Yeah, hi. That was a great presentation. Thank you. I have a question in terms of the accuracy. What's your measured accuracy for a radiologist without your platform? In other words, what's the benefit in terms of accuracy, sensitivity, specificity, as compared to just what we traditionally do?
So basically, we have a classification system, we have a comprehensive report generation system, and we also have abnormality detection, which many companies are struggling to do. So if you see the breast cancer full mammogram, then our platform can detect the abnormalities in the breast cancer lesion, which is basically a hard task to do. That is what we are currently doing with very high accuracy. And to answer your question, basically we are our accuracy measures are in AUC. If you see Google's accuracy score, Google has published a Nature paper in January or February 2020 with a AUC score of 74%, whereas our accuracy is 96% on the open source data. So that's what it is.
What is the measured accuracy of a traditional radiologist who reads mammograms without decision support?
AUC score, that's what they do. AUC score and also percentage score and sensitivity and specificity. That's what Google has done, and we are following the same thing. We are following the same measure.
So without any sort of platform, sort of before these great tools like yours existed, what was the accuracy rate of radiologists for like breast cancer?
Yes, basically the accuracy rate for radiologist was around 68 to 70% and AUC, and Google was able to achieve 74% accuracy, and ours is around 96% with open source mammogram data.
Thank you.
Thank you.
Can you just speak to, a present company excluded with Faz and Oren as our doctors on the panel, but, sometimes doctors don't think that they have a problem or need help. So how can you give us a little bit of insight into how the conversations with the doctors go? How hard is it to convince radiologists that they need this?
Yeah, definitely. We are, a lot of time doctors think that they don't need a second pair of eyes, but sometimes it's very obvious that due to visual fatigue, which I already mentioned, that it is required that they can solve the issue very quickly. And our platform is able to achieve the accuracy in a faster way. And if you see the literature survey, then a radiologist is able to solve the read the radiographs in an hour. They can read up to 8 to 10 radiographs, whereas we can read up to thousands of radiographs. That is the difference what we are making, so with higher accuracy. So that is what I want to say.
Great. Balint, any question or feedback?
Great presentation, and it's a really promising technology. My question is, compared to your competitors, how can you convince the potential buyers to choose a new solution instead of a bit lower accuracy current solution? So that 9% difference, is that important?
Yes, Balint. So basically, in the competitive advantage slide in the quadrant chart which I showed, the majority of our competitors were in the range of 74 to 90%, and they were doing 1 to 3 disease targets, whereas ours is a universal disease platform. We can basically read radiographs like CT, mammograms, MRIs, PETs, anything, and our accuracy accuracy is up to 99%, which is huge. I mean, 8 to 9% accuracy is huge for medical industry, you know, like we are saving a lot of lives. This 8 to 9% matters a lot when it comes to saving lives. That is why we were able to convince some hospitals and radiology clinics. I mean, I understand your question. Though it takes a lot of time and effort and a lot of persuasiveness to convince doctors and hospitals, but we are trying our best.
Okay, great. Great discussion. It's voting time. All right, so judges, let's give AidMedx a vote. So we got a 5, a 4, a 4, 5 and 3/4. All right, great. Great job. Okay. Last but certainly not least, we have Anne Monpara with Intiva Health. Anne, can we see your slides and hear you?
Yeah. Let's see.
All right. They're up. Okay, so we're ready whenever you are.
All right. So my name is Aimee Health. I'm the Chief Medical Officer at Intiva Health. We originally started in 2016 as a practice management company for surgical services and emergency rooms. Today, we've shifted our focus to helping healthcare providers, facilities, and ultimately patients by improving healthcare administration by way of credentialing, compliance, communication for improved patient outcomes. Between our executive leadership, we have over 50 years of clinical and non-clinical experience in healthcare. Our platform is a SaaS product, and it is the first DLT, distributed ledger technology, healthcare management platform in the country. It is based on blockchain, and we specifically use Hashgraph for speed, security, and storage to help save money and time and reduce risk for healthcare facilities. Through our practice management past, we realized that a lot of healthcare facilities were struggling with communication tools. They weren't easy to use. They didn't have easy access to these things, and they didn't meet privacy guidelines, kind of like what's going on with COVID right now, where a lot of HIPAA regulations have been relaxed. Healthcare administration itself is a separate hurdle on its own, and a lot of time has been spent on just credentialing and compliance, and that detracts from patient care, and it increases physician burnout and provider burnout. The average day to credential a physician or any licensed medical professional is around 55 days, and it can cost up to $150,000 per month per provider in revenue to a facility. And so what we've done is that we have created a SaaS-based platform, there we go, that is an entire suite of products. So our ReadyDoc platform provides a credential management platform that allows for payer enrollment. It also includes a HIPAA-compliant messaging solution that allows for care team communication and collaboration, fully encrypted. And we also have a custom learning management system that we provide to any provider to take continuing education classes, all within a single point of access. Coming Q4 of this year, we will be introducing our teledoc feature. It's going to be able to be white labeled for any type of healthcare facility. Easy to use, don't need an application to download. It's a one link directly into an encrypted room for patients to discuss their cases with their providers. The messaging solution integrates with EHR systems. You're able to pull and share any kind of CTs and MRIs, lab results, and then have collaboration with other providers, either for a second opinion or to discuss M&M conferences and so on. Our core platform is our credentialing platform that allows for streamlining the provider management of any hospital. And so you're talking about when it comes to payer enrollment, these processes can take several weeks. Our platform autofills applications and sends it out for e-signature. We pretty much cut the process in half, allowing facilities to start generating revenue from these new providers that they're bringing into their facility. And our custom LMS allows us to white label our our learning module for any healthcare facility. Any kind of licensed medical professional can take accredited courses. We partnered with 5 or 6 different entities to provide us with these courses, from Peace Health and American Heart Association. We will soon be finalizing our agreement with the American College of Emergency Physicians to bring on additional courses to our platform. And the one thing that sets us apart from anything else in the market is that we are fully fledged DLT based on our platform. So all of the information and documents that's stored on the platform is immutable. It is pretty much as close to hack proof as you can get, but it allows for significant speed in terms of transactions and transfer of data. Over the last 3 quarters, we've noticed we've experienced quarter after quarter growth of 35% every single quarter. We have had numerous different facilities jump onto our platform that were on competing platforms such as Simpler and Cactus and MD Steph, simply because of our product portfolio and the ease of use of just having one single vendor to provide a suite of products.
Ian, you're out of time, so
okay.
Can you get to your ask?
Yes. So we are currently in raising debt capital right now. We are expecting to exit within the next 3 years, but we are open to any strategics in terms of helping us scale the platform as we move forward.
Okay, that's great. Judges, any questions? Go ahead, Balint.
Yeah, thanks for the presentations, really interesting. And my question is, how can you compete with these specialist companies? So you have to provide different applications, and how can you beat that companies who just focus on delivering the best telemedicine platform, the best messaging platform, the best learning platform?
It's easy. You have to make it easy for your customers to do business with you. And with a hospital, I'll give you a prime example, especially with COVID. A lot of our critical access and rural hospitals that were using multiple vendors for different items that they were using for either their LMS or for credentialing management, they were outsourcing things. They did not have the ability to track a lot of that information. We provide them with a single platform that allows them to do everything. They can manage telehealth appointments for their providers. They can have internal collaboration for a patient that's sitting in their ER room. They'll be able to manage providers from a risk standpoint to make sure they're not on any exclusions list, because we offer monitoring as a part of the platform. And it's a single place for anybody in that facility, whether they're an admin or frontline staff, to go to become better at their job and to provide more efficiency through the system.
I see, thanks. And what's your pricing strategy compared to the standalone companies?
So we are priced at around 50% of what our competitors are offering on the market. A lot of these competitor products charge a per price per provider per month. And we do a custom package pricing dependent on what their needs are. So if there's somebody out there that just needs the credentialing software, we can provide a price specific for that. But if they would like other services like our messaging or a custom-made LMS for their providers, we're able to create an all-in-one pricing package. And it's not per provider. It is per month for a facility, regardless of how many people are in their system.
Thanks.
I have a couple of quick questions. Ian, really great presentation. Looks like you guys are doing a lot of terrific work. What is your exit strategy for this company, and like how big do you think the market is for a solution like this?
So the market is pretty big. If we're looking at a provider level, there's a little under 1 million physicians in the country and right under 10 million nurses. But our platform is provider agnostic. So it applies to dentists, veterinarians, CRNAs, LVNs. It does not matter what your license type is. You are able to use our platform. And our platform allows any licensed medical professional from the first day of their career through the last day of their career to manage the business sides of their careers as long as they're in practice. And so our exit strategy is to hopefully become either acquired by another company that's in the larger space of credentialing. Simpler has been doing that for the last several years, where they keep acquiring competitor competitors in the marketplace to have that monopoly there. But we also see an opportunity for an RCM, revenue cycle management company, to join with us and be able to provide that portion of the credentialing world in connection with our provider appointment and privileging.
All right, any other questions? Go ahead, Michael.
The 35% quarter-over-quarter growth is phenomenal, but it's based on technology starting from a baseline level. So just trying to figure out what your future projections are. You can't expect 35%
yeah, so
perpetuity.
Yeah, so our strategy has always been to try to make connections wherever we can to at least do beta research sites for our platform. And we'll do a side-by-side comparison to a lot of facilities that are currently using a paid software or they're outsourcing. And so we do the implementation for free, and then the staff can make the decision in terms of what's their preferred platform. A lot of the feedback we get is that our platform is incredibly easy to use. A lot of the paid software, it takes them to run a report maybe 3 to 4 minutes because you're running through so many different menus to get to what you want. And our user interface is really the key here for us to win those accounts over. On top of that, with COVID, what we've done is a lot of companies have pivoted in the marketplace. They put a lot of holds just because the financial situation with healthcare has been wonky. And we just decided to go harder. And that's the only thing you can do is to really react to the market. The way things kind of happen in healthcare in COVID was to go 200 miles an hour instead of 100 miles an hour. And it worked out for us. We're pretty lean. We wear multiple caps in the company. So wherever we can find some efficiencies internally, we try to use that. There were times where even I was making calls, not just my business development team. But we have to do what we got to do to drive the company forward.
Terrific. Any other feedback or comments?
Just curious about, just a very quick question. You're raising venture debt rather than venture capital. Can you explain? I assume you're pretty significant in revenue.
Yes. So the second quarter, our revenue has been anywhere for every healthcare facility between $5,000 and $30,000 a year. And that depends on the package that they select. We customize everything for each facility that's in contract with us. But a lot of that has been just the growth by word of mouth. In tech, we're located in Austin, Texas. A lot of our rural counties out here that have been either outsourcing the software and the provider management, they wanted to bring it in-house, but they couldn't afford to hire somebody on staff. Well, we can provide them everything that they need with their current staff for maybe a quarter of the price for them to bring on somebody new. And that took off like wildfire.
Thank you.
Yeah.
Great. All right, judges, it's voting time once again. So scores, fingers up. So we've got a 4 and a 4 and a 4, and Balint, we got a 4. So we got 4s across the board. Okay, so I think you guys can all agree that we had 4 terrific startups present. Judges, thank you for your feedback and questions, and startups, certainly thank you for your pitches and all the great work that you're doing. I'd like to remind you that nobody's going to walk away empty-handed, and all startups participating in today's session are eligible for a free product discovery from Bene Studio, so be sure to take advantage of that. And so the prize for the winning startup is a one-on-one coaching session with Runway and a product discovery and planning session with Bene Studio. And the winning startup is going to be highlighted as the telehealth startup of October, and Bene Studio does a terrific job of amplifying you. And then also that includes an exclusive interview published on the Telehealth Networking Club page and across Bene Studio and Runway social media channels. So Wellsheet is the telehealth startup of October. So congratulations to them. We'll certainly follow up with Craig and let him know the good news. We are going to have, as I mentioned in the intro, Our next event will be in November, and we will expand. That event will be on November 19th, and we'll be expanding the focus from telehealth to health tech. So seeing a little bit more diversity in terms of types of startups in here. So if you want to join the Telehealth Networking Club, that will allow you to be connected to startups, investors, healthcare providers, and other key players in the health tech industry. Please go to the Bene Studio website to learn more about that. And thank you all for joining us today. And we hope to see you next month at the Healthtech Rapid Conference on November 19th for another exciting discussion and around health tech and digital health. Thank you, everyone, and judges and startups again in particular. Thanks to you.
Thank you, Sandy.
Bye-bye.
Take care, all.
Thank you, everybody, and congratulations.